So in the sulfa drugs, mechanism of action is quite important. So first of all, you are having the bacteria, they are having actually the para-amino benzoic acid, which is actually mixing up with pteridine. Okay, and this one is actually converting into dihydroteric acid. Okay, with the help of an enzyme. And what is the name of this enzyme? That is actually dihydropteroid synthetase. Okay, what is the DHPS? That is the dihydropteroid synthetase. Okay, dihydropteroid synthetase. So that is the DHPS. Then what will be happening? This dihydroteric acid is actually converting itself into DHF. And what is DHF? That is actually the dihydrofolic acid. Then this DHF is actually converting itself into what? THF, tetrahydrofolic acid. And then this tetrahydrofolic acid is actually making up what? Purines and pyrimidines. Purines and pyrimidines are actually what? Nucleotides, right? Nucleotides, nucleoside, remember purines and pyrimidines. And nucleotide, they are the unit of what? DNA, which means I'm talking about genetic material of bacteria, right? Okay, if I will be doing some kind of problem in the making of purines and pyrimidine, I will be stopping the what? DNA machinery inside the bacteria. If there will be no genetic material inside the bacteria, how the bacteria will survive? Right? So that's how we came up with the concept of sulfa drugs. Okay, so PABA plus pteridine, they are actually converting into dihydroteric acid with the help of DHPS, that is the dihydropteroid synthetase. Then it was converting into the DHF. DHF is converting into THF with the help of enzyme, that is dihydrofolate reductase. That is DHFR, dihydrofolate reductase. Okay. Then we are having in the sulfa drugs, we are having two drugs. One is sulfamethoxazole, and one is trimethoprim. So what is happening? Sulfamethoxazole, actually it is inhibiting what? It is inhibiting dihydropteroid synthetase. So if you will be giving sulfamethoxazole to the patient, that bacteria will not be able to make dihydroteric acid. On the other side, trimethoprim is actually inhibiting what? DHFR. Okay, so if you are giving trimethoprim to the patient, this DHF will not be able to convert to THF, and if there is no THF, how will it make purines and pyrimidines, right? Okay, nowadays what we are doing, we are actually giving the combination of that. We are using the combination of that, and we are having the double effect. Okay, so we are using the sulfamethoxazole plus trimethoprim. So sulfamethoxazole, we are combining it with trimethoprim. Okay, and trimethoprim, and this combination is called as they are having several names. It is also called as Bactrim. Okay, it is also called as Biceptol 480. This is the trade name of that one, Biceptol 480. And then it is also called as clotrimoxazole. Okay, it is also called as what? Clotrimoxazole. Okay, clotrimoxazole. So nowadays we are using what? We are using the combination of sulfamethoxazole and trimethoprim. This combination is called as clotrimoxazole. What they will be doing? We will be having the double effect. On what part of the bacteria they are covering? Genetic material, right? That is the nucleic acid. Yeah. Okay, fine. So that was about what? That was about the sulfa drugs. Okay, that was about the sulfa drugs. Then sulfa drugs can be used in malaria also. Sulfa drugs can be used in, yeah.
chlorotrimazole is the same which we give in toxoplasmosis.
Toxoplasmosis, yes, you can give in the toxoplasmosis.
But it was
You can call it as chlorotrimazole, you can call it as chlorotrimazole, that is the same. And for the toxoplasmosis, you can use the trimethoprim also. But the thing is, if you are having the combination, better to give the combination to the patient because it will be giving the double effect. So you will be making sure that yes, this bacteria will not be spared, right? Okay, so in the toxoplasmosis, you can give that. In the pneumonia cases, you can give that. Okay, fine. It can also be used in malaria. Okay, malaria. And okay, it is having one of the side effect which is actually considering, that is the crystalluria. Okay, so in many patients it has been seen that the patients who are on the sulfa drugs, they are having the side effect as crystalluria. So if the patient is having crystalluria, you should be telling to the patient that you should drink more and more alkaline water. Okay. So in the crystalluria, what should be done? The patient should be drinking more and more alkaline water. Okay. So sulfa drugs, they are having the side effect as crystalluria. Okay.